It might seem like just a casual observation. Maybe you've noticed you're walking a little slower than usual, or a friend who used to zip around now lags behind. But doctors are paying close attention because a subtle drop in walking speed might be more than aging or laziness. It could be one of the earliest clues that something deeper is going wrong, especially in the heart. Walking speed, it turns out, is a surprisingly powerful diagnostic marker, not just for fitness, but for health at the organ system level. Your natural walking pace reflects a coordination of cardiovascular output, musculoskeletal strength, and neurological function. When any one of those systems falters, especially the heart, it can quietly start to show up in how fast you move. And the shift is often so subtle that you won't notice it until you're measuring it. That's why researchers are beginning to use walking speed as a clinical red flag, an early warning system that something in the body may be breaking down before symptoms become obvious. Several studies have shown that a sudden or unexplained decline in walking speed is linked to undiagnosed cardiovascular disease. The heart's job is to pump oxygen-rich blood to your muscles, especially during movement. If that system isn't working properly because of clogged arteries, heart failure, or arrhythmias, your body compensates. One of the first adaptations? You slow down. Not because you're consciously trying to, but because your brain instinctively knows you don't have the energy or oxygen delivery capacity to move as quickly as before. It's like your internal engine goes into energy-saving mode without your permission. Doctors have even started using timed walking tests, like the 6-minute walk or the 10-meter walk, as a quick, non-invasive way to assess a patient's cardiovascular health. In older adults, walking speed is sometimes an even better predictor of mortality than traditional risk factors like cholesterol levels or blood pressure. The decline in pace can precede a diagnosis of heart disease by months or even years. It's your body waving a flag before a crisis hits. And it's not just the heart. Slower walking speed has also been associated with cognitive decline, particularly in diseases like Alzheimer's. That's because walking isn't just a leg function, it's a brain function. Your brain orchestrates every step, calculating balance, rhythm, and direction in real time. When cognitive processing slows down, walking does too. It's a physical expression of neurological health. In this way, walking pace becomes a 2-for-1 biomarker, giving insight into both your heart and your head. That's why a change in walking speed shouldn't be brushed off, especially if it comes on quickly or without an obvious cause like injury or illness. If you or someone close to you is suddenly taking longer to cross the room, lagging behind on familiar routes, or getting winded on short walks, it might be time to look deeper. What seems like minor slowness could be the body's earliest whisper of something serious. The good news is that catching it early can lead to interventions that work, whether it's a stress test, a heart scan, or just building in more consistent movement to strengthen the system before it declines further. So the next time you notice a change in someone's walking pace, don't just chalk it up to getting older. Ask why. Because beneath that slower step, there may be a story your heart is trying to tell.